resident nurse from Cebu.
So, good day everyone. So, I will be discussing about the fibrosing mediastinitis. So, we have our learning content. First, we have the overview, signs and symptoms, risk factors, pathophysiology, anatomy and physiology, medical management, surgical management, nursing management, and nursing diagnosis. So what is fibrosing mediastinitis? So fibrosing mediastinitis is a rare, chronic, and progressive disease characterized by excessive buildup of scar tissue or fibrosis in the mediastinum, the space in the chest between the lungs. So the fibrosis can compress and narrow vital structures in the chest including blood vessels, airways, and the esophagus, leading to a range of symptoms and complications. Next, we have the signs and symptoms. So, the signs and symptoms of fibrosing mediastinitis. First, we have shortness of breath or the dyspnea, fatigue, cough, chest pain, hemoptysis or coughing up blood, dysphagia or the difficulty of swallowing, superior vena cava or SVC syndrome, recurrent pulmonary infection, and pleural effusion or the fluid accumulation between the lung and the chest wall. Let's proceed to the risk factors. So the risk factors of fibrosing mediastinitis, we have histoplasmosis infection, idiopathic, autoimmune diseases, and prior radiation therapy. So histoplasmosis infection, the most common subtype of FM, post-histoplasma fibrosing mediastinitis. This is triggered by an exaggerated immune response to a previous infection with the fungus Histoplasma capsulatum. The fungus is found in soil, particularly in the Mississippi and Ohio River valleys. Next, idiopathic. The less common subtype, idiopathic FM, has no known cause and may be associated with autoimmune diseases, vasculitis, or other rare disorders. Other risk factors include the autoimmune diseases. Individuals with autoimmune diseases may have a higher risk of developing fibrosing mediastinitis, especially the non-histoplasmosis related form. Next, the prior radiation therapy. So radiation therapy to the chest can also increase the risk of fibrosing mediastinitis. So, pathophysiology. So, the exact mechanisms underlying the fibrosing mediastinitis are not fully understood, but it is believed to involve an abnormal immune response. So, first, the exposure to Histoplasma capsulatum. So, this is the most common trigger for post-histoplasma fibrosing mediastinitis or the PH-FM. Immune response. The body's immune system recognizes Histoplasma capsulatum antigens as foreign, and this triggers the immune response. Next is the granuloma formation. So the T cells, macrophages, and other immune cells gather in the mediastinum, forming granulomas or the clusters of immune cells in an attempt to contain the infection. So this leads to excessive fibrosis. So the granulomas release inflammatory mediators and growth factors that stimulate the production of collagen and other extracellular matrix proteins, leading to excessive fibrosis or the scar tissue formation. In the mediastinum, it is happened. So compression of structures. So the fibrosis can compress and narrow vital structures in the chest, including the blood vessels, airways, and esophagus. And also, this will lead to impaired function. So the compression can lead to impaired blood flow, impaired airflow, and the dysphagia. The anatomy and physiology. So, the affected system of the fibrosing mediastinitis, the respiratory system, and the cardiovascular system are the primarily affected. So, what happens in that area? So, in the respiratory system, the fibrosis in the mediastinum can compress and narrow the airways, leading to airflow obstruction. This can result the shortness of breath, wheezing, and the recurrent pulmonary infections. So the fibrosis can also affect the lungs themselves, leading to reduced lung capacity and impaired gas exchange. Next, the cardiovascular system. So the fibrosis can compress major blood vessels in the chest, including the superior vena cava, pulmonary arteries, and pulmonary veins. This compression can restrict blood flow, leading to symptoms like SVC syndrome, shortness of breath, fatigue, and even heart failure. Medical management. So the diagnostic process are the chest x-ray, computed tomography scan, magnetic resonance imaging, bronchoscopy, and blood tests. So chest x-ray can reveal abnormalities in the mediastinum such as widening of the mediastinum or calcification of lymph nodes. The CT scan, this is the most effective diagnostic tool for FM, providing detailed images of the mediastinum and allowing for assessment of the extent and severity of the fibrosis. The MRI can also be used to further evaluate the extent of fibrosis and to assess the involvement of other structures in the chest. Bronchoscopy. This procedure can be used to visualize the airways and to obtain tissue samples for biopsy. And lastly, the blood test. This may be used to rule out other conditions to assess the patient's overall health. The medical treatments are the corticosteroids, immunosuppressants, stenting, oxygen therapy, diuretics, antibiotics, and pulmonary rehabilitation. So corticosteroids, these medications can reduce inflammation and may temporarily improve symptoms. The immunosuppressants medications may be used to suppress the immune response, but their effectiveness in the fibrosing mediastinitis is not well established. Stenting procedure can be used to open narrowed blood vessels or airways. Stenting can help improve blood flow and reduce symptoms like shortness of breath and SVC syndrome. Oxygen therapy, supplemental oxygen can help improve blood oxygen levels and reduce shortness of breath. Diuretics medications can help reduce fluid retention associated with vascular obstruction, and the antibiotics may be used to treat complications such as pneumonia. The pulmonary rehabilitation program can help patients manage their symptoms, improve their physical function, and enhance their quality of life. We will going to proceed to nursing management since surgical management or the surgery is rarely used for fibrosing mediastinitis due to its high risk and limited effectiveness. So in rare cases, surgical resection of localized scar tissue may be considered, but it is only appropriate for carefully selected patients at specialized centers. So the nursing management, we have first the assessment. So respiratory assessment, regularly monitor respiratory rate, oxygen saturation, and lung sounds to assess the severity of the symptoms and detect any changes. Cardiovascular assessment, monitor blood pressure, heart rate, and for signs of SVC syndrome such as facial swelling, edema in the arms, and distended neck veins. Assess for dysphagia, monitor for signs and symptoms of aspiration, and ensure adequate hydration for the gastrointestinal assessment. In the neurological, monitor for signs and of altered mental status, confusion, or changes in the consciousness which may be associated with hypoxia or SVC syndrome. Pain assessment, we have to assess for chest pain and discomfort, noting location, intensity, and any aggravating or relieving factors. Next are the interventions. So, oxygen therapy administration, we have to assist with the administration of oxygen therapy, ensuring proper flow rate and mask fit. Medication administration, administer prescribed medications including corticosteroids and immunosuppressants following proper dosage and timing. Breathing exercise, teach and encourage patient to Practice breathing exercise such as diaphragmatic breathing and pursed lip breathing to improve lung capacity and reduce shortness of breath. Encourage patients to participate in the activities within their tolerance level and teach energy conservation techniques. This is to manage the activity. Next is the education and support. So provide patient with information about the fibrosing mediastinitis, its causes and management strategies. So offer emotional support and resources to help patients cope up with the diagnosis and its implications. And lastly, the patient education. So, understanding the patient's disorder, explain the nature of the fibrosing mediastinitis or the FM, its causes, and its potential complications. In the medication adherence, emphasize the importance of taking medications as prescribed and discuss potential side effects. Lifestyle modifications encourage patients to adopt healthy habits such as quitting smoking, maintaining a healthy weight, and getting regular exercise within their tolerance level. Coping strategies provide information and resources for coping with the diagnosis, management symptoms, and reducing anxiety. And then refer patients to support groups for individuals with lung disease to connect with the others and share experiences. So, in the nursing diagnosis, we have ineffective airway clearance related to airway obstructions as evidenced by wheezing, stridor, and dyspnea. Impaired gas exchange related to pulmonary obstruction and reduced lung capacity as evidenced by decreased oxygen saturation, increased respiratory rate, and shortness of breath. Activity intolerance related to fatigue and shortness of breath as evidenced by decreased levels, increased dyspnea, and with exertion and reports of fatigue. Anxiety related to diagnosis, potential complications, and uncertainty about the future as evidenced by restlessness, worry, and difficulty of sleeping. And lastly, deficient knowledge regarding fibrosing mediastinitis and its management related to lack of information and complexity of the disorder as evidenced by questions about the disease treatment options and prognosis. And that's all about my report and discussions about the fibrosing mediastinitis. Thank you.